March 6th, 2014. As the sun sets in McAllen on this clear Thursday evening, South Texans gather for a candlelight vigil to mourn the closure of an abortion facility that has been serving the Rio Grande Valley for 40 years. They are here to bear witness to the stories of the patients served by Whole Woman's Health, which for the last 10 years has provided safe, legal abortion in a building that has been a destination and a haven for Texans seeking abortion care since Roe v. Wade.
This is very similar to my actual story. I'm 23 years old from McAllen and a single mother with one child.
I'm from McAllen. I just turned 18 years old. I'm unemployed and a full-time college student. I cannot afford to have a child.
I'm from McAllen. I'm 24 years old and I'm confident with my decision. I know I'm not financially ready for a baby.
I'm from Mercedes. I'm 32 years old, a mother of three, and I'm living with my parents.
Legal abortion in the Rio Grande Valley ended in November 2013 when part of Texas's omnibus anti-abortion law, HB 2, went into effect.
For the women and families of Texas, justice has not been served. HB 2 is an injustice to those in Texas seeking the legal right to end an unwanted pregnancy safely.
For months, Whole Woman's CEO Amy Hagstrom Miller tried to keep her clinic open for ultrasounds and preoperative appointments while she attempted to secure admitting privileges for her doctor at local hospitals, which is just one of HB 2's 4 medically unnecessary new requirements for abortion providers. But after a cold reception from hospitals and no public support from the doctors who have been referring their patients to Whole Woman's for a decade, she knew she couldn't keep the doors open indefinitely in this deeply conservative community.
And especially because of the stigma that's around reproductive justice and women's health, it's really even hard to talk about it.
People are scared. People where we socialize tend to
be very judgmental about it.
Exactly, about sex, about abortions, about contraception. Everything that goes into that topic, they have a lot of stigma, and it's very difficult to push away that stigma and realize, hey, you're confident enough to make the right decision.
This week, Whole Woman's Health also announced the simultaneous closure of another rural clinic, their Beaumont facility in southeast Texas. Staff there joined their counterparts in the valley through a live stream for the candlelight vigil. Both clinic closures illustrate what has been so enraging and so heartbreaking for reproductive justice advocates here. The most marginalized Texans, the Texans with the fewest resources, are the ones whose health and lives are most threatened by family planning budget cuts and medically unnecessary abortion regulations that push abortion into back alleys and across the border.
Even way before all these new policies and the HB 2 and the 2011 family planning cuts, healthcare, reproductive healthcare was not easily accessible for women, especially in low income immigrant women. So it was affecting them, and now it's going to affect every woman in the lower Rio Grande Valley.
The Whole Woman's Clinic in Beaumont performed about 3,000 abortions per year, while 2 clinics in the valley, including Whole Woman's in McAllen, performed about 2,600 abortions per year. Where those patients will go now is unclear. Some will carry to term. Some will find a way to drive or bus hundreds of miles to major city abortion clinics, and some will try to end their pregnancies on their own.
I think the statistic is 60% of women who seek abortions have children already, and so I was one of those 60% of women, and so the lovely young women that were here today, they helped me through everything that I needed for the procedure, and it was really amazing, and I feel very blessed to have gotten their love before this all happened, and it is truly devastating that this is happening now.
Though conservative state legislators, both anti-choice Democrats and Republicans, seem to believe that they can ignore their most vulnerable constituents, these valley residents have plenty of fight left in them. There's talk of organizing carpools and bus rides from the valley and southeast Texas to the major cities that, come September, will house the only 6 safe legal abortion facilities in Texas that will be able to comply with the new law. We don't know yet what will happen to the Texans who can't make it to one of those 6 facilities. But tonight in the Rio Grande Valley, a promise has been made to remember them, always.
won't forget.